Brian Moran, founder of Government CIO. Welcome to Government CIO Magazine.
Hi, this is Hillary Wax with Government CIO Magazine. Today we will be interviewing Dr. Neil Evans, the co-director of Connected Health with the Department of Veterans Affairs.
Agile methodologies let us accomplish two things. First, we can get product done faster because we have a process that allows us to more quickly iterate and get to this really the second advantage, more meaningful product. That is, because we have the business owner and the subject matter experts, the customers, really embedded into the development process, we get the product that they want. We're less likely to come up with a product that's missing features or disappoints the customer. We're able to get there sooner. So that's been the real advantage. The number one recommendation that I'd make is to make sure that you have really that you have significant engagement and understanding by your business owner. It's really the value of Agile in my mind is that you take people who have the technical expertise, the developer community, who know how to make really amazing products, but you bring in the business owner into that process, and that marriage is critical. And I think that for us, the lesson that we've learned is that that requires very clear communication up front with business owners, with those who are recruited to be subject matter experts. They need to understand what is the value of Agile. They need to understand what the expectations of them are, and they kind of need to get a sense for how they can contribute in a meaningful way, what their role is. It's, I think in the IT community, in the developer community, Agile is becoming something that we all understand, but you know, I'm actually not an IT person, I'm a physician, right? So when you ask me as a physician to engage in an Agile process, I kind of get it because I also do IT. When you ask one of my colleagues who doesn't really understand how to create an IT application, a mobile application, for example, to be a business owner, you have to really help them understand not just the Agile process, but really what are we trying to accomplish. And so that upfront work of getting buy-in, setting realistic expectations, in my mind, is the most important thing. Well, the Agile process gives you lots of opportunity for iterative feedback and lessons learned. And in VA, we have quite a few mobile applications that we're developing simultaneously in parallel, which means that you don't always have the same people at given sprint reviews. So we may have 5 applications in development at a time, and it's not the same developers at each of the 5 sprint reviews. It's not the same subject matter experts at each of the 5 sprint reviews, or business owners, or whoever the folks are, usability, our human factors, engineering folks, our patient safety folks. You may be attending different sprint reviews, but there's a real opportunity, particularly when you're creating a suite of mobile applications, to take lessons learned from one project and make sure that they get applied to other projects. For example, one of the things we've learned is that there's really value in developing a common framework for the user interface for your mobile application, so that though you may be developing 5 applications simultaneously, all by 5 different teams, intended for healthcare providers to use to help take care of their patients, you don't want to give your healthcare providers applications that have 5 completely disparate user interfaces that don't make sense to them. And so taking lessons learned of, gosh, we were following the style guide, we were using the standard user interface, but we've realized that in this clinical setting, that doesn't really work, and making sure that you've communicated that with the other teams who are developing similar apps has proven to be a real value of of the Agile ceremonies of having this opportunity to come back and reassess on a regular basis. Mobile development, mobile applications and really web applications are, and they're really web and mobile applications are allowing us to deliver really workflow-focused health applications to help both patients manage their healthcare and healthcare teams. And let me explain in a little more detail where I think there's real value here. For healthcare providers, the electronic health record is a core resource that we need to take care of patients. And the electronic health record is a large application with lots of features, the ability to customize your views and do all kinds of different things in it. But there are many circumstances in healthcare where providers, staff members are asked to do a single task over and over again where there is a specific workflow. And when you ask somebody to take this electronic health record with all of its functionality and do the same thing over and over again, and sometimes in a way that the EHR was not designed to enable, you create kind of wonky processes for your users. And where I see tremendous value for healthcare providers, or the healthcare teams, staff members, is mobile applications that can enable them to really get in and get out and do these workflow-focused tasks. I'm running an immunization campaign in the atrium of a medical center at a VA where I have to give out 50,000 flu vaccines over the next 2 months. Wouldn't it be nice to have a mobile application that lets me, from soup to nuts, run that for every patient who comes in? You come in, I can register you on the mobile app, I can email you the vaccine information sheet, I can get your consent for the vaccine, ask you the pre-screening questionnaires, I can give you the shot. The mobile application can't give you the shot, but anyway, I can give you the shot, I can document that, record it in the electronic health record, actually record the workload requirement, record the sort of the back business functions, and have all that done in a single streamlined workflow. I think that's where mobile applications will really make a difference in healthcare delivery. And those mobile applications, the power of those mobile applications are that they go beyond the first generation of mobile applications that have been applied to healthcare. The first generation are standalone mobile apps, databases that give me as a physician the ability to look up health information and figure out how drugs interact, et cetera. This next level of mobile applications, where I think we'll see the transformative role of mobile, actually connect to our back-end systems. They allow you to connect to the core IT platform, but do so in a nimble and novel way. For patients, I think mobile applications will transform health IT, because health is something that occurs when you're on the go. You don't spend much time with your doctor every year, but where health occurs is in your life, when you're out on the go. And now we have mobile devices that are in our pocket all the time that allow us to get access to our electronic health records, for example. So the ability for me to have my electronic health record in my pocket, the ability to write a secure message to my physician, to request my prescription refills, to engage in transactions. This really changes the health paradigm. It lets me start to manage my health care on the go. It lets us, as the Department of Veterans Affairs, provide services in significantly greater ways than we can do when it's just when our care delivery is constrained to face-to-face visits within our facilities. We're doing most of our mobile development as basically infrastructure as a service using the cloud. And we think this is really important because the ability to rapidly scale mobile applications when they're deployed in the cloud is much greater. And one of the lessons I think that has been learned outside of healthcare and outside of federal government healthcare is that you never know when an application is going to become wildly popular. And the ability to deploy these applications in the cloud and to be able to dedicate resources to them when they become popular and they're needed, and to scale them up is I think going to be critical moving forward. And just allows us to concentrate more on what matters, and that is, how do we create compelling mobile apps that engage our customers and lead to better quality healthcare. Well, appropriately, federal health IT cares a lot about privacy and security. We have to comply with federal legislation that applies to the federal government, but also HIPAA and other legislation that applies to healthcare in general. And so that does require us to spend a lot of time making sure that when we are developing product, that we are paying very close attention to both privacy and security. I think the other limitation in federal health IT is there's not, there is a high standard for success. You have to succeed, which does require you to get the right people on the team and to really pay attention and think in advance of what are the issues I need to anticipate in developing this software platform. And those constraints, I would argue they're not really constraints. They're good practice guidelines for developing software that is safe and effective and protects the data of the American public. I think that mobile, and not just mobile, but health IT in general, we're at a really exciting time where we're able to put the tools in the hands of patients that will allow them to take control and manage their own health care. There's no better advocate for your own health than you as a patient. And we talk a lot about here in the government about the importance of interoperability. We talk a lot about the importance of sharing data with the people that we're supposed to know, with the DoD and with other partners. But one of the exciting things for me is that connected health is what we call them in the VA, connected health tools like our personal health record, My Healthy Vet, our VA mobile apps, are really tools that start to put this data in the hands of the veteran in particular for mobile apps, on their mobile device, which provides, in many ways, a form of interoperability. If I have a young patient who's receiving some health care from the DoD and also receiving health care from the VA, and they have a VA mobile app which has all of their electronic health records on it, when they go see their DoD provider, it's all there. In fact, they can generate a blue button report, a PDF, send that over to their DoD provider, and we start to create the interoperability that we need. We start to create data we put the data in the hands of the person who should own the data, the patient, and allow them to leverage that for their own health. And that's, in my mind, really one of the exciting parts of what's happening in the mobile space now.